Carotid artery stenosis. The important things here related to AMC exam is the following. First of all, what are the indications of carotid artery surgery in case of the stenosis? The first one is if the narrowing more than or equal to 70% of the lumen. This is the first indication that need surgery. The second indication is that if the narrowing more than 50%, but there is another neurological sign in the patient, like transient ischemic attack or dizziness or loss of vision. So there is more than 50% narrowing of the lumen with another neurological sign. This is the second indication for carotid artery stenosis surgery. So if there is a case talking about patient suffering from dizziness or loss of vision, which is transient loss of vision like in TIA, and there is narrowing of the carotid artery about, let's say, 55%. Is this need surgery? Yeah, this is a highly recommended for surgery. And what is the surgery that I'm talking about? The important surgery in case of carotid artery stenosis is end arteriectomy, as shown in this picture. Now, let's talk about important note here. If the patient already has ischemic CVA, as shown here in this picture, there is no need for the surgery because the brain is already dead. There is no need to open this narrowing. You know, the vital organ is already dead, so it's useless. That's all related to carotid artery stenosis for AMC exam. Now let's talk about Berger disease. What is Berger disease? For the AMC exam, the keyword for Berger disease is as following. The case scenario talking about young male, and this young male is smoker, along with foot problem. What I mean by foot problem, any foot problem in young male, smoker, it means Berger disease, like amputations or recurrent claudications, or there is gangrene, maybe finger gangrene, maybe multiple finger, maybe all the foot, I don't care. Young male with smoking and foot problem, whatever it is, then this means Berger disease for the AMC exam, and it's important. Arterial injury. The important thing for arterial injury for AMC exam is the following. If you have a patient presented with arterial injury like in this picture, what is the next step? What is the first step? The first step or the next step is make direct pressure over the area. It's important, direct pressure. Then surgery. So make direct pressure while preparing for the surgery. This is important. Another important example for the AMC exam. Patient undergoing catheterization of the femoral artery, whatever the reason. And after the catheterization, there is bulging area formed at the area of the entrance of the catheter. And it is pulsatile. That means there is bleeding. There is hematoma formation. So how to deal with this patient? This means arterial injury by the catheter. And the first step here, or the next step here, is direct pressure while preparing for the surgery. It's important and it's a previous recall for AMC exam. That's all. Arteriovenous fistula. Well, simply, it's a direct connection between the artery and the vein. And this will lead to arterialization of this vein in order to use it for dialysis. So what is the important thing here? The important thing here is that when the heart is contracting, the blood will be directed directly from the artery to the vein, then returning to the heart in fast way. That means there is no distribution of blood, or I mean there is no distribution normally as seen in normal hand. So the blood will be directed forward from the artery to the vein, then returning to the heart. And that will lead to increase the preload in the heart. And increasing the preload in the heart make the cardiac output high. So the only fistula that causing increase in the cardiac output is arteriovenous fistula, and this is the only important note that I need here. That's all for AMC exam. For full course, please contact us through amcqbook@gmail.com, and please remember to make a like for this video and subscribe and turn the notification icon for this channel if you find this video helpful. Thanks and see you later.